Plantar fasciitis. It's an inflammation that leads to calcification. If you look at this picture, this represents plantar fasciitis, okay? And this X-ray represents the calcification, and the X-ray is very important, okay? For the keyword of it will be pain in the foot that increase with the start of walking and then subsides. The idea of it because due to washout of inflammatory cells with walking, as this is an inflammatory reaction. In X-ray, you will see a bony spur, which is very important. Look at this X-ray. This represents the calcification, and also it's called bony spur. And it's also a keyword for plantar fasciitis in AMC exam. For treatment, simply non-steroidal anti-inflammatory drugs, as it's an inflammatory reaction. That's all. Take a look at this X-ray, as it's very important. Achilles tendon rupture. It's either partial or complete. Well, look at this picture. This represents complete tear of Achilles tendon, and this another photo represents partial tear. On exam, if there is no gap feel, then this is partial tear, and if there is gap feeling, then this is complete tear. For treatment, in case of partial, then it's conservative, but in case of complete, I mean there is gap, there is complete Achilles tendon rupture, then this is emergency, and you need to make emergency surgery in less than 3 hours. The idea of it is if you lift the tendon and postpone the operation, this will lead to healing, contracture, and shortening of the tendon, which make a huge problem, okay? So you should make emergency surgery in less than 3 hours in case of complete Achilles tendon rupture. Important note, a drug causing Achilles tendon rupture is quinolones, okay? That's all. Fractured tibia and fibula. Let's start by fractured tibia. Fractured tibia can cause bleeding inside, and this can lead to compartment syndrome, which is a huge important risk here, okay? While fractured fibula, common peroneal nerve is passing around the neck of the fibula. If you look at this picture, this represents common peroneal nerve, and this is the neck of the fibula. And common peroneal nerve is moving or passing around the neck of the fibula. So fractured fibula, I mean neck of fibula, can cause common peroneal nerve injury, and that will lead to foot drop, as common peroneal nerve is supplying the muscles that cause dorsiflexion of the foot. So injury of common peroneal nerve will lead to foot drop, which is a very important in AMC exam. That's all. For full course, please contact us through amcqbook@gmail.com. Thanks and goodbye.